Mr. Jordan, I'm Dr. Rob.
55-year-old David Jordan has suffered a heart attack. His doctor is suggesting an angiogram to see if a blocked artery needs to be opened up by angioplasty.
What we're planning to do to try to figure this out is a heart catheterization.
But does he really understand what he's consenting to? Research shows patients often don't have a clue and may end up having a procedure that doesn't help and may even hurt them. A frequent example? Angioplasty when you're not having signs of a heart attack.
It's used much more than it needs to be or would be if patients were adequately informed. 40% of the elective procedures are unnecessary.
Most patients think non-emergency or elective angioplasty will make them live longer. In one report, 88% thought it would prolong their lives by about 10 years. Emergency angioplasty can save patients with signs of a heart attack, but the rest of the time?
Elective angioplasty does not reduce your risk of death. It does not reduce your risk of heart attack. That's a huge amount of money that's being wasted on a procedure that can only carry risks.
Dr. Fisher says proper informed consent would eliminate 30 to 40% of other unnecessary expensive procedures like angioplasty, spinal fusion, knee replacement, and hip replacement. The problem starts with consent forms. A review of hundreds of consent forms at more than 150 hospitals found them to be of, quote, limited value. They are not standardized, loaded with confusing language. They are often missing specific risks, and generally not well explained by doctors.
The key is to involve patients in the decision making.
David Jordan is part of a pilot program at Dartmouth, which is personalizing the process. It starts with taking a detailed medical history, such as age, weight, and overall health. By searching a database of angiogram results, doctors can then estimate your individual risks and benefits by finding out what happened to patients just like you who had the same procedure.
It's not generic. It's for people like you. And if we get that right, we'll create a better informed consent and a better understanding.
The chance of a heart attack or loss of life is less than 0.5% in your case.
Is this you? Okay, great.
Another innovation is interactive patient aids. This 30-minute video preps patients on risks.
There is a risk an artery may be injured during the procedure.
This one is being used by more than 100 hospitals nationwide.
Because the more you know, the more in control you'll feel.
Ultimately, Jordan didn't need a stent, but his case illustrates the value of a new personalized consent process that encourages, even forces doctors to consider, is this procedure right for this patient? Especially important because so many people do whatever the doctor says.
He just explained it to me and I trusted him.
Do you think that's what most people do?
I'm sure, yeah.
The goal, less risk and less waste by making doctors and patients partners in the decision-making process. Katie?
Really interesting and important story, John. Thanks so much.